what is HPN mission for those who doesn't know? I know you guys were involved in different deeds, especially for those who are people in Sudan. But what does HPN stand? What are the main missions of HPN?
Yeah, HPN's mission is to support and provide assistance, humanitarian aid to those who are in despair, and to basically provide medical assistance and provide health care, and also like provide assistance in anything that's unmet, right? In the unmet areas, because we're not a big organization, we're just small, we're starting out, we're a small community, but definitely we are making an impact. We are powered by our donors, our community, even allies as well. We definitely love our allies, both here and all over the world. And so, like SOS, you know, Operation Rescue. Operation Rescue is an amazing organization. Ma'adot of Tigray.
Just holding Tigray.
Yeah, IDER, and those guys, and even our Sudanese partners, like Chores and different organizations. So we are powered by them, and so this is what we're doing, you know, to just make a small impact in our community.
It's not a small impact,
yes.
Trust me, because we have seen your work, we have seen HPN work, and we have seen the testimony from all the way from Ma'ala and from Sudan.
Yeah.
But my question is, what would, like, how can people help?
Yeah.
Because when we hear HPN, Healthcare for Professional for Tigray, and people think, oh, it's only for nurses and doctors and pharmacists.
Yeah.
But as a Tigrawi, as a diaspora, how can I help?
Yes, we are. We are composed of healthcare workers, healthcare professionals, but that's not where the bucket stops. We have people in the business sector. We have people who know supply chain management, logistics. It's important to move things around. We have data analysts, we have IT, we have advocacy subcommittee. We have those who are in the health policy, you know, public health officials. And so we want them all. You know, social media is huge. You know, we need support in social media. As well. I think one of the things we don't do very well, as you said, in the Tagalog community, is we don't know how to speak up for ourselves. We don't know. We know how to. It's just we don't, because we're very reserved.
Why?
Yeah, we're a reserved community. We're not boastful. We don't advertise. We're not in your face, right? We are very humble, and also we like to do things behind closed doors, you know. And so I think we need those that are very crafty and creative in design and things of that nature to come and support. So we welcome anybody who wants to join our social media team, advocacy, IT, logistics, as well as, you know, procurement. People in pharmaceutical who work for pharmaceutical companies, you know, they have a nonprofit arm. Like, you know, Tigray needs insulin. You know, Tigray needs syringes. Syringe. There's a lot of needs.
The things that we took for granted
exactly.
here.
Yeah, masks, gloves. I mean, that's a big thing. So we need those that are connected to those organizations to come and help us. You don't have to be a member, but we love for you to be a member. We are powered by our members. We are powered by our communities.
What is a member versus just one of it? What's the difference?
Yeah.
What it takes to be a member?
So a member, the way we define it, is a member is someone who is dedicated to HPN and is willing to do work and actually put things into action, right? And that's what we need. We move really fast. We don't like to hang on to money.
Right.
We want to release that money as fast as we can. So that way, we live in an emergency world right now.
For the last 600 days.
Exactly. We can't wait, right?
Yeah, I have seen you and Dr.
Dr. Rishan,
yes, talking to people, and HPN is actually a center of attention on this wa'ala, from what I see.
Yes.
You guys have a big booth in there. What is people asking?
Yeah.
What are the people asking? What do they want to know about HPN?
Yeah. So, you know, the major thing, the major reason why we're here is to talk about our mental health. mental health is so important in our community because we're in a moment of fire and we're moving.
Mental health in the diaspora or
Yes,
back home?
both. Yeah, because if you know, Ruth, who is part of our mental health, said the most beautiful poetic thing. She said, "Your health is Tigray's health," and so that's what we're promoting today. And so there's people who wrote books about mental health, like Fanus. There are, mental health pamphlets that we're handing out for free. Just open it up, read on how to cope with these atrocities, grief, and trauma that we're having. And so we have Dr. Samhala Bai as well as Rahel Haile, who was presenting. We are training trainers to go into our community and build healing circles, and a safe space for people to talk about what's hurting them, what's giving them grief, what's giving them pain.
It's actually a good point that you raised. It's actually correlate with Wa'ala mission. Wa'ala is actually building a community
here,
so you can actually go and talk to your people, be there, learning your heritage.
Yeah.
So how do you guys actually working with the community?
Yeah.
Is it a close compound working together, or what is the relationship seems like?
Yeah, as you can see, we're here. So we support our community wholeheartedly. We support other organizations as well, like Asmalash Grant, TDRF. These are just a few organizations that I can name off the top of my head, but Hawatna, Ma'adot is huge right now. They're doing great work on the ground. Back home in Tigray, in Makale, and even surrounding areas. They go into rural areas when they could find fuel.
Exactly.
And so I think we need to power these organizations. They are our sister organization on the ground. And so I think, working with the community is extremely important. You have to be able to know the culture, know the language, and so that way you could communicate, right? And connect on a commonality basis. Right now we're doing a pilot program in Sudan. It's the Education and Wellness Program. It is in partnership with ECDC, as well as HPN4 Tigray. And God, I'm forgetting one more organization, but I'm sorry. But there's multiple organizations that are part of this, and what we're doing is we're meeting the community where they are, and we're using certain cultural tools, whether it's bunna or giving them a sustainability process in businesses. In the community, and so play therapy is a thing for the kids. And so that's what we're working on right now, to meet them where they are. And if this pilot program is successful, we want to implement it in Tigray. And also we had a preliminary safe house in Tigray. It's still operating. It's not a full-fledged safe house yet, because safe houses, they need mental program. They need different types of program within the safe house. Within the facility. But that's our aim with Frowaini Mabrahatu, who's our board member. And we work with Dumbesco as well, Catholic Charities. And so we're doing a lot of things. And so mental health is the focus. It's going to be a huge focus for our people. Even our doctors need mental health, especially after the atrocities that they've seen.
They have witnessed.
They have witnessed. And then to rebuild the healthcare system, infrastructure-wise. Medical records. We don't have any medical records right now. We need to know how to synthesize the medical record and make sure that it's regurgitatable, right? And so we can regurgitate it to the mass. And social media is a mechanism and an avenue to connect with the mass, right? With allies and allies alike, and even our community, so they can. It's a quick way to connect. But we. We would like to, continue using social media, but also we want to do community in-person outreach now that things are opening up. We have work in field in Tigray. We have a couple of people going back and forth not Tigray, to Sudan. To Sudan. I wish we had access to Tigray, but back and forth to Sudan. And so they can help in any way that they can, in terms of whether it's children education, whether it's mental health,
health,
or even connecting and sitting down and having a conversation like you and I think it's just important. You can be a sustaining donor. You can follow us on all social media, Twitter, HPN4Tigray, the number 4, Tigray. You can sign up for a newsletter. We've got a monthly newsletter that comes out. All you got to do is go to www.hpn4Tigray.org, and then you can register for all types of information, you know. So support, you know. We are powered by you guys, so thank you.
Thank you very much.
Yes.